Welcome to the Brimful Podcast. I'm Pamela Tessman, an IBCLC, a mother of two, and former childbirth educator, doula, and ACE. I share evidence-based tips and stories on infant feeding and the perinatal period. This podcast is for educational purposes only and is not a substitute for medical advice, so please always see your healthcare provider if you have concerns. Be sure to follow me at brim.familycare on social media or visit my website at brimfamilycare.com. Let's get started. Welcome back to the Brimful Podcast. Today, I'm really excited to have Alix Meyers here from Love Tenderly. Is that what it's called? Or?
It's Tenderly, but the website is Love Tenderly. So
okay,
there you go.
Great. So you are a doula, and
yes.
You specialize in supporting neurodivergent families, which is amazing, and I think we need a little bit more of that. You're based in Montreal. Yeah, Awesome. Well, thanks for coming on today. It's nice to see you.
Thank you. Thanks for having me. I'm really excited to have this conversation with you because you are also a birth worker specialist in the field who has understanding and knowledge and specialty in neurodivergence. So It's exciting for me to have these conversations.
Yeah, we can nerd out a little bit on it.
Exactly.
So how did you get started in this work?
Well, my path wasn't direct, I'll say that. I had a full career before this in marketing, advertising, branding.
Oh, very opposite.
Yeah. So then I had three kids, three neurospicy kids.
Okay.
And even before I understood the neurodivergence in my family, I was quickly burning out, and it was just impossible for me to be doing the job I was doing that I didn't really love and take care of my kids in the way that I wanted to. So it was kind of like a balance thing at the beginning and what I wanted to do. But I had always been doulaing, if I use it as a verb. But, anytime anyone in my family, friends, vicinity would have a baby, I ended up taking on that role of support. And my husband at one point was just like, why don't you just be a doula? And I think he might have been joking, but I took it seriously. And I did my first certification and I was obsessed and in love, and it just rolled out from there.
Great. Which certification did you do?
So I started with a certification from Yoga Mamas, which is in Toronto. And that was just postpartum, because postpartum is my passion. I'm obsessed. Yeah. And then it wasn't enough for me. I needed more. And I did Bebomia. So I did their maternal support practitioner, which is full spectrum, fertility to postpartum. And then I've done 100 other side things, but those are my main two biggies.
Awesome. That's great.
Yeah.
I've heard a lot of good things about Bebomia, so.
Yeah. It's wonderful. And I love that you see the whole perinatal period versus only digging in deep to one part of it.
Right.
But looking at the full spectrum together is really fantastic. And I think it empowers you as a birth worker to look at the whole journey, which is best for the clients.
Yeah, I was going to say it's really important for us to know their whole journey so that we can support them in a way that works for them.
Mm-hmm. Absolutely.
So you said your kids are neurospicy. Did you find that your postpartum was tricky that way because of your own neurodivergence?
So I didn't know.
Yeah, okay.
I didn't know.
A lot of people find out that way.
Yeah, I'll say this. Basically, we went through a journey in discovering my son's neurotype. And that was when he was, 6 to 8 or 9. And once I started learning more about neurodivergence, neurodiversity, and different neurotypes, then training as a doula, it became this, like, I couldn't avoid it. I was looking back on my own perinatal experience saying, wait a second, it didn't have to feel the way it felt. And I was so unprepared for how challenging it was. And it was only once I started digging in and learning that I realized, first of all, I realized my own neurodivergence. And also I started seeing how my sensory, overload was impacting my postpartum experiences, how executive functioning was coming into play for me, while I was pregnant. All of these different lenses that I look at now from a professional standpoint, I started looking at my own experience. And that's kind of how this specialty was born. It was looking back at what I went through, realizing that it didn't have to feel that way for me. Had I known my neurotype, had I had the right support in place, and had I been looking at all of these different facets that I was so unaware of. And talking about the sensory experience is just so big. Talking about executive functioning, and then really like looking at my communication styles and skills versus how I was being talked to and how information was being disseminated to me. Like all of those different pieces came into play as I was learning about neurodivergence in general.
Okay, because that's what I wanted to ask you too, because as far as I'm aware, not a lot of doula training includes that neurodivergence piece. So I wondered if you had just kind of learned along the way. So yeah, that's a tough way to learn it.
Yes. I mean, listen, no, I have yet to find a doula training that incorporates neurodivergence into it. I am starting to, one of my parts of my business that I'm building is I'm starting to, tap into these trainings and like kind of becoming a guest speaker, bringing this information. Because I do, I do feel like it is so important. 15 to 20% of the world's population is neurodivergent. It's 1 in 5. So if you think about your clients as a birth worker, 1 in 5 of your colleagues, 1 in 5 of your family members, that's not a niche, right? It's not like I want to do this on the side. This is part of your business. So Bebo Mia is one where I'm now, as like an alum, I'm going back and I'm part of their training now.
Amazing.
Yeah. And so trying to, if you're a doula agency or you're a doula trainer out there, get in touch because I'd love to join your program.
Yeah.
And part of this is advocacy, right?
Yeah, absolutely. Yeah. And so I guess one of my big curiosities too is, like you and I, we didn't discover our neurodivergence until later in life. So do you have tips for parents who may be in their postpartum and they're feeling, oh, am I, having sensory sensitivities, or why all of a sudden am I feeling like my executive functioning is lacking? How do people manage, how would you say to manage those feelings if you haven't already identified as a neurodivergent person?
It's a great question. So I'm going to generalize a little bit, and I don't love to do that, but I'm going to say that if you are thinking, I mean, we're all on social media in a new way. And if you're seeing these reels and videos about the autistic life experience or ADHD specifically in women's brains, but if you're seeing these and you are thinking, hey, that feels like me, chances are there's some neurodivergence happening. Because what we tend to see is we don't tend to see neurotypical people looking at the experience of a neurodivergent person and saying, I relate to that. They don't really relate to it, right? So first of all, understanding that neurodivergence is an identity, you don't need a diagnosis. It's all you're saying is my brain is built differently. That's all you're kind of saying in identifying as neurodivergence. Now, is it associated with ASD and ADHD and anxiety and depression? Of course, yes, because those brains are built differently. But you don't need a diagnosis to be neurodivergent.
Yeah.
And I think that's a really big gap in our understanding of these keywords in language, is that you don't have to have this diagnosis. As an adult, I would not recommend going through a formal diagnosis. It's very expensive and it's not necessary. We do it for children because they're in school often and they need accommodations. And unfortunately, the system isn't built to give accommodations unless you have that piece of paper.
Yeah.
So if you're an adult and you're saying, I think my brain is built differently, I think I might be neurodivergent. Amazing. Fantastic. You're in the club.
Yeah.
Just by feeling that way, right?
Yeah.
And then I think it's about educating yourself about your neurotype. Because if you do not know what sensory sensitivity means, if you don't know what executive functioning means, those keywords, that language, you're going to have a really hard time pulling apart why this feels so hard, why you're so overwhelmed, why you're so emotionally dysregulated. And so my first recommendation to anyone is start learning about yourself and learning these keywords so that you can self-identify what it is that's pushing you kind of over the edge. Right? Because I can come in, listen, I know what these words means. I've learned them about myself and I work in this. So I can come in and I can say, okay, like I'm looking around, I'm walking into your house. I can see there's a lot of sensory, overload happening. There's a lot of this happening. But if you're not working with a doula that gets that piece, unfortunately, the onus is on you to communicate what your needs are.
So tricky.
It's so hard. And if you don't have the language for that and you can't figure out what's going on inside, it's really hard to say, I need the lights turned off, or I need to be in the quiet, or letdown is so painful for me. It's incredibly difficult to identify and pick apart what is happening, because when you're in overload, when you're in overwhelm, when you're in executive dysfunction, you don't have the capacity to figure it out.
And possibly the compassion for yourself too, because our culture is so much about doing it on your own, being okay, not having any postpartum mood disorders. And so it's really hard to even say, I'm having a challenging time. These feelings are difficult for me. I don't know what it is, but maybe it's just anxiety. It could be anxiety, but it could be so much more. So hopefully folks who listen to this podcast will feel a little bit more empowered and compassionate to reach out and say, I'm having a hard time. Yeah,
absolutely. And I'll just add to that. If you have grown up neurodivergent and maybe you did have a diagnosis, you did not have a diagnosis, the chance that you have RSD, which is rejection sensitivity disorder, is so great.
Yeah.
And it's part of our neurodivergence. It's part of the way that we grew up in the systems that weren't in place to support us. So it's even harder to be kind to ourselves. It's even harder to be soft to ourselves, because we did not grow up with that softness towards us, right? And our brains and our bodies and our nervous systems are now built that way.
Yeah.
So it's so true. It's kindness towards yourself, and it's being able to communicate your needs and ask for what you need.
Yeah, and it's going to take some bravery, because that RSD often makes you feel like you're just not safe with anybody.
Mm-hmm.
So reaching
Yeah,
out for help is really hard. So we get that. Yeah.
absolutely.
So you offer virtual doula support for
Yes.
neurodivergent families. Can you talk us through
Yep.
how that works?
Absolutely. I would say virtual doula support really kicked off in COVID when doulas weren't actually allowed in the hospitals.
Yeah.
And what we saw was that it was great. It was really fantastic. And it worked really well. So what that means is we go through all the same processes in terms of preparation and planning for birth. So what that looks like for me is I do like a big birth planning session with you. It's like 2 hours. We bring your partner into play and we talk about everything. We go through sensory, like all your sensory needs and what you want your birth to feel like. We talk about executive functioning. We talk about communications. And then we talk about all the regular birth stuff, like pain management, choices, all of that stuff. And that is, for the most part, I would say 90% of the time, that's done virtually for me. It allows, especially for neurodivergent families, it allows them to be in their safe, cozy place. And if that's far away from me, that still works. I also love, and this is one of my favorite sessions I do, is a postpartum planning session.
Lovely.
And again, that's like 2 hours. And we really get into the nitty gritty of what your postpartum is going to be like, what boundaries you want to set at this point, how you're going to work and balance with your partner, how we're going to deal with sleep and feeding and all of those things. So all of those things that are part of my birth package already happen virtually. When I'm present virtually for your birth, I'm on call as I would be if it was a live, an in-person birth from 37 weeks. And then let's say you're going into labor, I'm just with you virtually. So anytime something comes up, I'm with you on the phone. I'm basically home just waiting for you to call me. And we make those decisions together. So a nurse walks in and asks you, hey, do you want Pitocin? Or hey, do you want an epidural? And you say, hold on a second, I'm going to call my doula. And then we sit on the phone and usually it's FaceTime. And we talk about what's going on and we make those decisions. So you feel empowered to advocate for yourself and you feel like you've got the support system, but I just may not be physically in the room. And it's not for everyone. It's not what everybody wants. But what I've noticed in my business is that it creates accessibility in a way that we didn't have before. For me, it's different for every doula that does virtual support. For me, it's less costly if I'm there virtually. I also am able to support you if you're in a different city than I am. And I think it's a great service.
Yeah, I think that's great too. When I was a doula, I was offering that during COVID. And I did find a lot of parents were like, I don't see myself being able to log into FaceTime and figure that out. So like you said, it's not for everybody, but I think it's a really great, as you said, an accessibility tool to be able to connect with somebody when that feels like it's, a thing that they can do.
I find that some people feel overwhelmed by the idea of having like a doula with them full time. And this is their other option.
Right.
I like options.
Yes, options are so good. Choices.
Choices.
Yeah. And so when you're doing your birth planning with folks, you're developing a birth planning course. Do they sometimes take that as well, or are they mostly into the one-on-one with you?
So it hasn't launched yet, but it will be launching. And I think it is, if I do say so myself, I'm so excited about it because it is so all-encompassing. And basically the idea is that the course, it's chunked down, it's really easy to digest. You can do it all in one weekend or you can do it like really spread out. And the idea is you walk away from the course with the birth plan ready to go. You've done the whole thing.
Right.
And that's a birth plan that you hand to your healthcare provider, you hand to your midwife, you hand to your doula. Currently, I'm doing them one-on-one. I think it might cannibalize the service a little bit, but there are people that, it's okay. There are people and there are families that really want the one-on-one, and I'll always continue that service because I love it. And I think it depends on your situation. I think it depends on your needs and,
your neurotype.
But the course, your neurotype. It also depends. Are you a first-time parent? Is this your third? I think that might change things a little bit.
Yeah. Well, that's exciting. I'm looking forward to being able to share that because that is definitely a niche that we're needing for sure. And that's self-paced.
Self-paced. Yeah. And because of my neurodivergence and because this is kind of my specialty, I really paid attention to keeping it so easily digestible. So like the videos are really short and everything's very interactive.
Perfect.
So a big awareness and accessibility with it.
That sounds like something I would have loved. I've taken so many online courses where I just cannot focus and digest the material because it's basically reading a textbook. I'm like, I'm out. I can't do it.
I can't do it.
No.
I just can't do it. TLDR, too long didn't read. That is my favorite invention ever.
Yeah.
Everything is too long for me. I can't read that much. So, and I love to read for pleasure, but when it comes to like
learning
textbook type, I need it quick. Like give it to me in a sentence and I've got it.
Me too. Yeah.
But it just has to be quick for me.
Yeah. Stop with all the details. I get it. And so I would say your approach to this, virtual doula support, the online programs, you're really tapping into what we call neuro-affirming practice. Would you be able to speak to what neuro-affirming actually means?
Sure. Ooh.
I think we've touched on that a lot already, but I think that word is,
I think it's so powerful. And I think what's amazing about the idea of neuro-affirming is that neuro-affirming care is not only for neurodivergent families. Neuro-affirming care is care that works better for everybody, whether you're neurotypical or neurodivergent. So I would say that neuro-affirming care, specifically when it comes to birth work, is care that is considerate of, for me, I call them my three lenses. So that's the sensory profile of your client and experience, the executive functioning of their experience, and the communication. And I think that if you are a birth worker who is looking through those three lenses, then you are providing neuro-affirming care. I think inclusivity of different neurotypes, and that starts from, I talk about this so much, but that starts from the first conversation, from that intake conversation. It's signaling that you are a safe person, that you are neuro-affirming from that first intake conversation. I think that makes you a neuro-affirming birth worker. It's also helping your client advocate for their needs. Right? And I hope that answered.
Yeah, that's great. Yeah, and it gives a lot of space for the two-way conversations to happen, right?
Exactly. I host a webinar every 2 months ish for birth workers about how to build a neuro-affirming practice. And my biggest takeaway is that making these changes, like integrating neuro-affirming language and neuro-affirming signals into your practice, does not mean you're completely changing your business. It's really small. It's very tiny. It's knowing what masking looks like. It's knowing when your client is masking using humor, and then how to like affirm that and also get them to feel safe with you so that they don't have to mask. It's having your, I call it your doula detective hat on and identifying neurodivergence even when it's not declared to you. Now, I don't mean it from like a diagnosis aspect. Like that's not your job. But if your client is really struggling to focus, if your client is fidgeting or stimming, do you know what stimming means? Like it's having that information and knowledge and then accommodating those needs and asking the right questions. It's not like a neurotypical client, you're going to ask them, hey, what's your neurotype? And they're going to be offended by that. They're going to think, wow, my doula knows her shit.
Yeah.
Like, this is fantastic.
Yeah.
So I think it's just across the board, it's being really like checked in to all of the different aspects of your client and their family's experience.
Yeah.
I talk about neurodivergent families. And what I mean by that is sometimes I'm supporting a family where the birther is the person that is neurodivergent. Sometimes it's the partner that's neurodivergent.
Right.
Oftentimes it's both, because we do know that neurodivergent people really love other neurodivergent people. So often it's both. Or sometimes I have two neurotypical parents, and then I have other children in the household that are neurodivergent. And all of those versions are neurodivergent families, because all of them are working and looking at the world and moving through the world from a place of neuro-affirming care.
I love it. Just the simple ways of just checking in and just tuning in to your clients, because that's what we do as birth workers anyways, is tune in to them and assess their needs. And even if they are having a hard time articulating that, I find that we can often co-regulate our nervous systems too. And even
Absolutely.
that is just huge. So sometimes you don't need words,
Often silence is what you need.
Yes. When someone is seeking out care from a care provider, are there tips that you have for communicating with their care provider about their needs?
Oh, good question. So we are all on this journey of understanding our brains and our bodies. And I would love to say to you, be as transparent as you can. Share as much as you can about the things that make you, you. Whether that's your specific sensory sensitivities or where you are right now. Are you struggling with executive functioning? Are you in overload? Are you in overwhelm? Are you in burnout? It would be ideal if you can communicate those from the start. That being said, it is our job as birth workers to create a place of safety where you feel comfortable doing that, and to ask you the right questions to prompt you to do it. So as the client, I would love to say, like, come to me, open, tell me everything. I want to know everything about you and your life and everything that makes you feel good. It's not necessarily realistic to put that on the client. I think that a lot of it has to come from the doula, from the birth worker, and knowing the right ways to ask the right things. And, if you are, I'll say it this way though, but if you are someone who is pregnant, or you're thinking of growing your family, or you just had a baby, and you are evaluating or trying to find the right birth worker to support you, look out for those signals, those neuro-affirming signals. Check out their website, look at the language that they use. ask them for their intake form and look, are they asking about your neurotype? Are they asking about your sensory sensitivities? Look for those signals that let you know that they are neuro-affirming.
Mm-hmm. Yeah, great tips. And I guess it's also a matter of, for a lot of neurodivergent people, it's a matter of building up to that feeling of safety with your care provider.
Yeah.
So it's not going to be an instant connection in that way. So yeah, there's got to be some patience along the way, I guess.
Yeah, absolutely. And I know this is hard because it's hard for me, but if something makes you feel uncomfortable, I've never met a birth worker whose intentions are not to make you feel safe. So
Yeah.
try to give that feedback. It's
Yeah.
really hard for us to give feedback like that, but try to let them know. And that's how we grow within the relationship. And that's how we make sure we're really supporting you in the way that you need.
Absolutely. Because us as birth workers are in it because we care. So let us know how we can care for you the best way.
Exactly.
Do you find there are common challenges or fears for neurodivergent families when they're preparing for birth and postpartum?
Are there common fears? I would say that there's a lot of fear. Yes. Answer? Yes.
Yeah.
So what I notice when I have a client that's coming to me from in pregnancy is, for a neurodivergent person, pregnancy kicks everything up. But also there's a loss of autonomy and control over your body. And so what I find with a lot of neurodivergent clients is that they've already experienced in pregnancy this loss of control. And going into birth, which, the way that media and the world talks about birth is like big, scary.
Mm-hmm.
It's mostly about, I don't know how my body, I'm scared of how my body is going to manage through. And it stems from a place of anxiety. It also is a lot of misinformation. As neurodivergent people, we love to research. We love to information gather, and often we're not necessarily getting the best resources.
Mm-hmm.
So I find that there's a lot of, I already feel different in my body. Pregnancy is not what I expected it to be. It doesn't feel like this like beautiful fairy tale. I don't necessarily love when my baby moves, because that the sensory experience of my baby moving is not what I thought it was going to be. And now I'm going into this big, scary labor situation. And how is my body going to do this? How am I going to feel in that moment? So I see a lot of that, and I think it stems from them already being in that pregnancy piece.
Right. That's a huge change to your body that you've never been through before. So what do you do to help folks through that situation?
Well, first of all, there's a no Google rule. We got to get off. Right? So the first piece is I really encourage them to ask me for reliable, evidence-backed resources when they're looking for information on their own, so that you are coming from a place of you're coming from a place of like truth versus being fearful because you're seeing things on Instagram. Like, that's number one, is let's protect our headspace, let's protect our mental health, and really digest information that's safe. Number two, I would say it's a lot of emotional support, and let's focus on the information we have today. And the information we have today is that today my body feels good. Today I'm tired, so let's work on what the problem that actually exists is, versus anticipating what issues can arise. I also do a lot of education. It's a lot of answering questions about the big scary things that may or may not happen. And I'm very truthful. I'm very transparent about the realities and then reassuring them. I think also in that birth planning session, we end up alleviating a lot of the anxieties because you're going through the process of making choices and being empowered, walking into that, to your labor, no matter where the labor is happening. So it's a combination of different tools and tactics, and it really depends on their neurotype, how they like information delivered, how they want to be communicated to. Mm-hmm. But that being said, I'm going to say it's a lot of education. It's a lot of removing that fear mongering and focusing on the reality and the truth of what labor looks like.
Right. Yeah, lots of information is kind of a theme, I would say, for a lot of neurodivergent people. We really like data.
Love. And that's great, as long as it is truthful,
accurate,
it is evidence-backed, accurate, yeah. Mm-hmm. And also if it's serving you. So right. I have a tendency to go down a rabbit hole, and you get dopamine hits from positive and negative things, right? So it's protecting your mental health and knowing, is it helpful for me to really go deep and research, stillbirth rates or something that's super scary? Mm-hmm. How do I, when we talk about intrusive thoughts, so can I identify when it's an intrusive thought and when I need to go down a rabbit hole and really get some data? When is the data helpful and when is it not?
Mm-hmm. And how do you stop yourself from going down those rabbit holes? Because I know for myself that's difficult. So having tools, very hard. Yeah, I guess having a tool in place if you start noticing yourself doing that.
Yeah, I mean, there's things that work for me, right? Mm-hmm. I ask, first of all, identifying that it is an intrusive thought versus something that's actually happening in the moment. And then deciding if it's going to help me get through my day, right? Mm-hmm. Is this helpful to my mental health? Is this helpful to the goals I've set for my pregnancy and my birth, etc.? Mm-hmm. And it's almost like little scripts that you're working through.
Right.
But again, that works for me. And it depends on your neurotype. If you are twice exceptional, right? So you're gifted and have the way that you're going to handle intrusive thoughts can be very different than the way I just described.
Right. So do you help people tease out what might work for them in that case?
Yeah. That all comes in the intake conversation.
Right.
So as a birth worker, my feeling is that your initial intake conversation is the most important conversation you're going to have. And I built a client intake kit for myself that I now sell to other birth workers because it's so in-depth, but also really easy for your client. Mm-hmm. It takes a lot of the work off, and it ensures that you are getting the information you need to do your best support work.
Yeah, that's great. Because I also, as a lactation consultant, I have a big in-depth intake form, and I do find there are people who are like, whoa, I can't do this. This is way too much. And so there has to be some sort of compromise in those situations where you get what you need and not overwhelm your client. Yeah,
I'm building a lactation consultant version of this intake kit.
Awesome.
And you do need more medical history information than, let's say, run-of-the-mill doula work.
Yeah.
And it can be overwhelming. And I think part of that is reading the room and understanding, you can try and get some of that information beforehand. But the neuro-affirming piece of that process is also letting your client know, if this is too much, it's okay. We'll figure it out. We'll get the information when we can.
Totally.
And being flexible enough to shift and change based on their capacity.
Do you have a story for us? Is there a story of a client's journey where your support made a key difference? I feel like you've probably made a difference in a lot of people's lives. There's probably not just one.
Kind. That's very kind, and same, ditto. It's so funny because a lot of the stories end up being similar. One of the last births, I do a lot of in-person births just because, as I said, I have 3 neurospicy kids and my capacity for that. But recently I did a birth and partner was neurodivergent. And this was such a learning for me. I loved it so much. First of all, I love them. And we went front with me with what their needs were, what the partner's needs were. We had such a good plan in place. The partner left and went home a couple of times. It was a very long birth. It was 45 hours to sleep. I was able to take on that more physical. So I was able to take on the emotional support because I knew that the partner needed to also take care of their needs. I'm very big into both people taking care of their basic needs. Mm-hmm. It was just the most amazing experience, and I love them terribly. But the relationship, I would say, between myself and them was the transparency that they came to the table with made it that there was an immediate connection. I could anticipate their needs, and I could help them advocate so well with with their individual family's needs. It was amazing. I loved it. It was so great.
Love it.
I was exhausted, but it was so great.
Yeah. It's so nice when it just moves smoothly like that, where you kind of become one unit,
That's exactly it. It felt not like a throuple, but it felt like a throuple because we just were such a team. We were such a team. And in the end, my client walked away having a wonderful birth, even though it was really challenging.
That's so great.
So, yeah.
It just makes me think about the last episode that I did with another IBCLC, Erin Dykstra. We talked about how studies are showing that oftentimes, no matter the outcome of birth and breastfeeding, if you feel like you had good, solid support, you come out of that experience feeling good about it. And your mental health is supported that way. So, yeah, that speaks volumes.
I would say I absolutely agree with you. And I feel that I have clients who have pelvic births, and then I have clients who have C-sections. And sometimes the clients who have pelvic births, they walk out of there, ideally when I'm there, it doesn't happen this way, but they walk out of there and they didn't feel heard, and they didn't feel empowered, and they didn't feel seen. And even though they had the end result of the pelvic birth that they wanted, they came out of it traumatized. And then I have clients who wanted a pelvic birth but ended up in a C-section, but they gave informed consent, and they felt empowered in making that choice, and they felt heard and seen and respected through the process, and they loved their experience. Mm-hmm. So I think that when I talk about the success of a birth, I want you to feel great. I can't control what happens in terms of an end result. I can't control necessarily. There's things we can do to help, shift the process a little bit. But ultimately, if something goes down, something goes down. What I want for you as my client is that you get to make all these choices. You feel like you can advocate for yourself, and you walk out of there with that feeling seen and heard, empowered, right? Mm-hmm. That to me is a successful birth.
Absolutely.
If you have to have a C-section because there's, C-sections save a lot of lives, right? Yeah. There are good reasons to have a C-section. If that happens, okay. But did you get to make that choice? Were you in the power position there?
Yes.
That's going to change how you feel.
Yeah. Did you feel supported? Yeah. Do you ever get led
supported.
into the OR for C-sections?
So it's really hard. It depends. It depends on the hospital. It depends on the doctor that's on call. Sometimes we go through the whole process in our plan where they talk to their OB, and the OB is like, "Yeah, great, they can totally come in," but then whoever's on call is like, "Nope." Yeah, and I will say, if you're having a C-section, you need a doula even more,
Oh, yeah.
right?
Yeah.
So what I try to do is that even if I'm not in the room for the surgery, that I can switch in once the baby is born, because ideally someone stays with the birther and then someone stays with the baby. And so we try and do like that, like pitch hit kind of swap-a-roo. So I've had more success that way. When we birth plan, we talk about all of those scenarios so that everything is planned out. If the baby has to go to NICU, partner goes with baby, doula stays with birther. Like we have that. And if I'm virtual or if I'm just doing the birth prep, sometimes that's the case. We talk about like who's going to step in. So is that mom? Is that a sister? Like who's going to be the next person to stay with the birther for the recovery of the C-section?
Right.
It just depends on the scenario.
Yeah. My community doesn't have a NICU. We often, in larger situations, we have to transfer out. But I have been included in cesarean births, and it's lovely when they allow us in. The parent knows what to expect. They're supported through all of the things that are happening. Especially, I find, I think what surprises parents in C-sections is the shaking, the shivering throughout the surgery. And so when they can understand that that's normal, and or they are supported through that by a partner or a doula, it makes the whole experience way easier.
That is the goal, obviously, and that is always the preference. It depends on the situation.
It does.
It doesn't always happen.
Yeah.
And so if that's not a possibility, I think it's really important to know what plan B is going to be. And so that's a smooth transition, right?
Yeah.
And I like talking about those things in the birth planning session because it removes some of the fear to feel like, oh, wait, like if I end up in a C-section situation, A, my doula is going to be right there with me. B, I know what to expect, and I know that I can make some choices. I can lower the sheet. I can see that, like there are things that still fall within your control and you can ask for. I can never promise everything, but let's ask. Let's try.
Absolutely. It's always worth asking. Yeah. So if you had a magic wand and could change one thing about reproductive health systems in Canada to better support neurodivergent people, what would you change?
Boy, there's so many things.
Yeah.
So many. So my first one would be neuro-affirming education in hospitals, nurses, and OBs. Midwives too. Let's put midwives in there. They tend to be more neuro-affirming, but let's just throw them all together.
Yeah.
I think that if we were experiencing neuro-affirming care from that first prenatal ultrasound appointment, it would really change the outcome. Huge. So that would be number one. I just wish that it was part of their training. There was lunch and learns. I'll do the lunch and learns. Like, invite me to your OB clinic. I will come do a lunch and learn.
So before we move on from that, before you add more, follow-up question. What can people put into place now if they can't access a training? What would you tell people to use right now?
First of all, number one, you need to educate yourself on the big neurotypes. So you need to know what the perinatal experience is for someone on the spectrum for someone with ADHD, for someone with OCD, anxiety, depression. I'm going to say that's baseline.
Mm-hmm.
Second, you need to be asking what people's neurotypes are. And you need to be asking that in the same way you're going to ask if they have ever had a heart disease before, right?
Mm-hmm.
Like it's part of the medical history that you need to know about your client, your patient. And I would say the second piece for medical professionals is understanding the increased risk for perinatal mental health disorders and crises for neurodivergent families and birthers. Mm-hmm. Those to me are like the three most important things that you can pull into your practice right now. It's so easy. It's so easy to ask about people's neurotype.
Yep.
It's so easy to go on ChatGPT for all I care and ask ChatGPT. I can write a prompt that says, like, talk to me about the experience of someone on the spectrum as they are pregnant, as they give birth. Because, listen, is that evidence-backed? No, but at least you're going to get some understanding of what it feels like.
Mm-hmm. Great. I love that. Thank you. Okay, what else would you change?
So I live in Quebec, and I think accessibility to healthcare for me is big. I don't think that's specific to neurodivergent families or birthers. I think like it should be much easier if you want an OB to find an OB and to get in with an OB. It should be much easier. Please, why can't we have more midwives? Like it should be much easier to get midwife care. There's just a lack of accessibility. People are pregnant and they don't know what to do. And they don't know who to go see. And it's navigating the system is really challenging.
I didn't realize Quebec was challenged in that way. Are you finding that there's more free birthing happening because of that?
No, I don't think that there's more free birthing happening because I think that that's still so outside of like people's comfort level.
Yeah.
But I think what's happening is that they're not getting perinatal care until later on.
Oh, I see.
And so, there's a language thing that happens in Quebec too. This is I've brought up a very political, complicated situation, but it's finding a healthcare provider that will speak to you in the language that you feel most comfortable in. It's finding a practice that has openings that are taking on new clients, at a hospital that provides the care that you want. It's, how close is the support to where you live? How realistic is it for you to go to these appointments all the time? It's just not necessarily built with like real people's lives in mind.
Right. Oh, that's really unfortunate.
Yeah. But honestly, if you do have a doula, it makes it a lot easier because we have so many resources that we can share. We know how to navigate the system.
Yeah.
So even if you don't know that you want a doula at your birth, like reach out for some help in early pregnancy to find the right places to go for ultrasounds if you and to validate and affirm that experience.
Yeah, just having that consistency of one person walking alongside you throughout your pregnancy and birth is huge.
Absolutely. Mm-hmm. Absolutely.
So are you pretty busy? Are you pretty booked up these days?
In some aspects, yes. It's been amazing. Like the response has been amazing. For me, I'm spending a lot more time working with other birth workers, which I'm loving, because I can reach so many families, but if more birth workers are empowered to provide neuro-affirming care, like we're just reaching so many more people, which is fantastic. Mm-hmm. So I do have some openings in my schedule, but the response has been fantastic.
I love that you're doing this work. So where can people find you? Absolutely.
So follow me on Instagram because I do create way too much content and share so many tips and tricks and tactics. So if this is something you're interested in, like follow me. So it's lovetender.ly underscore doula. And maybe we can share that because it's long. Maybe we can share it somewhere.
Yeah.
And then my website is www.lovetender.ly. And that's how you reach me. And I would love, my DMs are always open. Like, please reach out. Let me know what's going on. And it's amazing how, like, one couple of messages back and forth can alleviate so much stress and so much weight that you may be feeling.
Yes. Fantastic. Thanks so much, Alix. I really enjoyed chatting with you today. And thank you all for tuning in today. If you want to connect with Alix, we have put those links in the show notes. Be sure to hit the follow button, like, subscribe, share. And if you want to support the podcast, you can buy me a coffee. And that link is also in the show notes. See you next time.